Chemotherapy can be an effective treatment for mesothelioma constrictive pericarditis, however it does come with some significant side effects that patients should be aware of. Some of the most common side effects of chemotherapy for this condition include fatigue. Chemotherapy often causes an overall feeling of tiredness and lack of energy. This fatigue caused by chemotherapy can feel different than normal day-to-day tiredness and may not be relieved by rest. It is one of the most common side effects that patients report. Nausea and vomiting. Chemotherapy drugs work by attacking fast-growing cancer cells, but they can also damage normal cells like those in the stomach and intestines, which sometimes causes nausea and vomiting. Nausea and vomiting from chemotherapy may start a few days after treatment and last for several days. Today there are very good anti-nausea medications that can help prevent or reduce these symptoms in most patients. Pain or discomfort. Chemotherapy may cause pain, tenderness or burning in the mouth and throat as well as the abdomen. This is because chemotherapy can damage the cells that line the digestive tract. Pain or discomfort from chemotherapy is usually temporary, but consistently taking over-the-counter pain relievers can help relieve it. Hair loss. Alopecia. Chemotherapy targets all rapidly dividing cells including hair follicles, which can cause temporary or permanent hair loss. Hair loss depends on the type of chemotherapy and amount given in each treatment cycle. Hair usually grows back once treatment is over, but sometimes returns thinner or a different texture. Wigs or hair pieces can help patients cope with hair loss. Diarrhea. Loose stools and more frequent bowel movements may occur during or after chemotherapy, which is caused by damage to the cells that line the intestines. Diarrhea is usually temporary and anti-diarrheal medications can help reduce symptoms. Infections. Chemotherapy suppresses the immune system, which makes patients more susceptible to infections. To prevent infection, patients receiving chemotherapy should avoid contact with those who are sick and practice careful hygiene. Medications may also be used to prevent or treat certain infections. Fatigue. Feeling tired and lack of energy is a very common side effect of chemotherapy. The fatigue caused by chemotherapy may last longer and feel different than ordinary tiredness. Mouth, throat sores. Chemotherapy can irritate and inflame the mucous membranes lining the mouth and throat, which can lead to painful mouth sores or throat sores forming. Proper mouth care and numbing agents are important to help prevent and treat sores. Nausea and vomiting. Nausea and vomiting are common side effects of chemotherapy, and are caused by damage to cells in the stomach and intestines during treatment. Today there are good anti-nausea medications to help prevent or reduce nausea for most patients. Diarrhea. Loose, watery stools and more frequent bowel movements may occur due to damage chemotherapy causes to intestinal cells. Anti-diarrheal medications can help reduce symptoms. Hair thinning or loss. Chemotherapy damages hair follicles, often resulting in temporary or permanent hair thinning or loss, known as alopecia. This side effect depends on which agents are used and the dose. Hair usually regrows once treatment is finished. Bleeding and bruising. Chemotherapy can reduce the production of platelets, which help blood to clot. This may lead to easily bruised skin or a tendency to bleed or bruise more easily than usual. Loss of appetite. For some, nausea and taste changes from chemotherapy cause a lack of appetite or interest in food. Maintaining good nutrition is important during treatment. Nervous system effects. Some chemotherapies can cause nerve issues like numbness, tingling or pain in the hands and feet. This is known as peripheral neuropathy. Muscle wasting or weakness is also possible. Memory problems or chemo brain. Some patients experience trouble concentrating or minor memory issues as a side effect of chemotherapy. This generally improves once treatment is over. Fatigue. Feeling extremely tired is common, as chemotherapy puts stress on the body. Rest is important, but too much bed rest can worsen fatigue. Gentle exercise like walking may help boost energy. Skin changes. Some chemotherapy drugs cause skin to appear sore or red in areas like the palms of the hands and soles of the feet. Skin may also appear darker in color. Menopausal symptoms. Chemotherapy can sometimes lead to infertility and menopausal changes in women by damaging eggs or ovaries. Symptoms like hot flashes, vaginal dryness, mood changes and loss of periods may occur. There are also some risk of rare but potentially serious side effects like cardiomyopathy, which is damage to the heart muscle, secondary cancers in the future due to chemotherapy or organ damage. The risks and severity of side effects depends on the agents used, dosage, treatment scheduling patient. Overall, addressing side effects properly is important for quality of life on chemotherapy. Patients should contact their care team if any concerning side effects occur. While chemotherapy effectively treats mesothelioma constrictive pericarditis, it commonly causes side effects due to damaging healthy cells. Fatigue, nausea, vomiting, alopecia and gastrointestinal issues are most frequent. Symptoms vary between individuals and managing side effects properly is key. Close monitoring by an experienced healthcare team optimizes outcomes by minimizing toxicity wherever possible. Patients should report any new or worsening side effects right away for evaluation and treatment if needed. Understanding potential toxicities empowers patients to partner with physicians in making wise choices about cancer care.